My name is Shruti Kothari, and I lead industry initiatives for Blue Shield of California. We're focused on scaling healthcare transformation through industry collaboration and alignment. You are at our first event for our 2001 speaker series, and we're so excited to have you. We have an incredible agenda planned for you all today. And before I go into some housekeeping, I just wanted to say we had over 400 people sign up for this event, which is just pretty cool. I think it speaks to the interest in the openness in our healthcare ecosystem of wanting to partner with one another to really make impactful changes. So again, thank you for being here. So our agenda for today, we're going to start with opening remarks from Melissa Buckley, who is the director of the Innovation Fund for California Healthcare Foundation. And then we'll move into a 30-minute panel featuring GM, who's the Senior Director of Community and Population Health for CommonSpirit Health, Johnice, who's the VP of Holistic and Community Health from Blue Shield of California, Moira, Kenney, who is the California Network Director for Unite Us, Sherry Novick, who is the National Community Health Lead for Kaiser Permanente. And then we'll have a special treat for you. We have three of our community leaders joining us for a quick little community lead section as well before we move into Q&A.
Hi, everybody. It's Melissa Buckley. It's so nice to be here today. Thank you for including all of us in the conversation. It is a really important one. My role here is just to introduce the rest of the conversation, and I will just say a couple things. The first is obvious, and it is that sadly and unfortunately, the organizations and people whose job it is to care for all of us, whose mission and intention and passion is to help us, can't. And that is obviously because the system, our medical care system, our social service care systems weren't designed to support all of us as whole people with physical and spiritual and everyday needs that are sort of so intertwined that one cannot be addressed without the other. And as we know, effective and equitable deliverable care is vital in California, and it requires that kind of coordination across medical and behavioral and social service and public health silos and separate operational organizations in order to make the care impactful. And I expect everybody on this call knows that. You're well versed in the challenge. You probably spend most of your days working on this problem or building workarounds to care for your clients and patients because of the fragmented nature of these systems. And you also know the scale of this. It's estimated 7 million people in California have multiple chronic conditions, and they account for almost 60% of our total healthcare spend as a state. Approximately 3.2 million have substance use disorders, 1.5 have severe mental illness, and all of that is compounded by social needs and social determinants of health factors that aren't being resolved. My job at CHCF is to connect healthcare providers and plans with innovative technology solutions if and when there's a potential for those two things to work together, those teams to work together in order to improve access and quality of care for underserved Californians. I don't think any of us would argue that the folks on this panel are the only folks working on these hard problems in California. There are many, many people who are trying to tackle these issues to improve quality of care and more integration with the medical and social service sectors. Kaiser and CommonSpirit and Blue Shield and Unite Us are not alone in their passion to make this work better. I do think that one of the things that's unique and uncommon is their commitment to work together, despite the pressures to focus on their own individual agendas, and despite the fact that they normally compete in the marketplace. These folks have spent the last year or so trying to figure out how to reorganize enterprise-wide systems and processes to engage community providers and organizations differently and figure out how to scale those new ways of working across the state. And no one would argue that this work is not messy. We all, I think, are feeling the growing pains of this new way of being in the world and trying to figure out how to make it work. But the challenge and the problem are clear. To address the challenge, we need new technology systems, we need new financial incentives, we need tons of technical assistance, And we need to build trusted partnerships and new relationships that take us all across the traditional silos in order to tackle these things together. So today, just in closing, to set us up for the panel, we're really hoping to tell you more about the work of this partnership and this group of folks, the progress they've made, the lessons we've learned, and really we've hoped to inspire people across California to reach for new partners and to reach for new ways of working together in order to tackle this. So with that, I will turn it over to back over to the panel and Shruti.
To kick this conversation off, first let's set just like a little bit of baseline. Moira, we'd love for you to kick off and just give us a brief description of what Unite California is and why is it important?
Since some of you may not yet have met Unite Us, we were founded in 2013 as a tech company. We build coordinated care networks that bring health and human service providers together to address the social determinants of health. What's exciting is that we were originally founded to serve veterans. Veterans who couldn't find the services they needed when they were working through our typical processes. So we support meaningful, secure collaboration. We make sure that healthcare organizations and social care organizations can connect together. But what makes us different and why this is important working with the three partners here today is that we do this by being in conversation with community. We do it with healthcare partners, with public agencies, with community leaders, and most importantly, the community-based providers who provide the social care that we need to elevate in our communities today. And we know that this requires changing how we all work. And so we do it in a way that allows our engagement team to work with organizations, to listen to them, to work with healthcare organizations, understand their needs so that folks can begin to create and accept referrals that really change lives. So we're currently live in 15 counties from Sacramento to Los Angeles. We cover geographies right now with more than 50% of the state's population. And working with our healthcare partners, we're building local networks across the Bay Area and Southern California this year. And by the end of the year, we'll be supporting 80% of the state's population with coordinated care networks that connect individuals to the services that they need. We have about 1,200 organizations on the platform. All of the community-based organizations are on for free. And they're able to connect their clients to food, transportation, employment, legal services, immigrant rights services, interpersonal violence. I mean, the list literally grows every single day. And I guess I would just say, turning it back to you, as someone who's worked in the social care field for more than 20 years, what really excites me is that every organization that comes onto the platform immediately expands their footprint from the work that they're able to do to the work that the folks down the street can do to help their clients reach their health goals.
That's really incredible. And that I think is a great primer for the industry collaboration part. It's tremendous that, Kaiser, Permanente, Blue Shield of California, CommonSpirit, California Healthcare Foundation, so many, and plus others, right, have come together to plan, design, implement, and now we're thinking about the scaling of this. Large enterprises, complex organizations. Tell us, how were you all able to do this? And also, how are you ensuring that we can make some systematic changes? Maybe Sherry, we'll start with you.
So let me just say, it was not difficult for us in the community health world to come together. We already know each other. We've worked on community health needs assessments together. We hire each other's staff. We're friends with the same organizations in the community. So it was an easy stretch for us. It is clear that in our organizations, I would wager we can all agree that there will be some challenges in building new workflows in to truly integrate attention to social care and social needs into our care delivery systems. But I don't think any of our organizations doubt the importance of it. And so we have a basis to move forward that I think is very firm, that we are all there. We recognize this has to happen. We have to look at whole people. I want to say, though, that we were aware that there could be some tensions given this is a very competitive world. And early on, Gia and I literally hammered out some principles of agreement. I don't think they've ever needed to be pulled out, but I did look at them the other day. And I just want to share that I think we are actually on target with what we're doing. Amongst some of the key agreements was our agreement that we're committed to building community networks to serve as a community utility, community-led, community-governed, and that's what we're on the road to do, that we are committed to ensuring that our process does not create or contribute to disparities and inequities, but actually helps to address them, and to supporting CBOs who are already, we didn't even know at the time, I mean, we did this in person back in the day. We didn't even know at the time what CBOs were going to be experiencing, right, with COVID, but our commitment to support them as well. So I think actually in this conversation today, we're going to be able to dive into these different principles and talk about how what we're doing can help us meet these commitments.
Oh, I still recall those conversations, Sherry, and now we have each other on speed dial, which is good and bad. And you know, what I would like to add here is that community networks need strong foundation, and the strong foundations, they don't get built overnight. You don't build a community network overnight. The local collaborations, the strength of the local community champions and the leaders, their vision to also think about how new initiatives, new technologies can align and integrate with existing work have to be critical. And so what's new here isn't just the partners, like Sherry was saying, we know each other, but it's how we partner together to create these systemic changes. And this partnership is pushing towards positive systemic changes because we strive to have an alignment of goals. We're discussing new ways to integrate current and new solutions and keeping the focus on the long-term vitality of the local communities, not necessarily just our own 2 to 3 year agendas. And it can't be large systems designing solutions for communities. It has to be true partnerships guided by those that are closest to the work. And so one example of how we're doing this is by ensuring that the community networks are community-led and are community governed with these neutral community conveners leading the effort. And of course, recognizing that some infrastructure changes are agnostic to communities. So with California Healthcare Foundations and the partners on the call here today, bringing these common emerging community challenges to light, for example, integration with the continuum of care work, alignment with the 2-on-1 efforts and plans, legal barriers to data sharing appropriately, we're now collectively addressing these issues together.
It's, you know, great that all of us are coming together to create this sort of third rail that will provide lots of resources to the things that are already working, and then also create some net new things since plenty isn't. But I think the level up opportunity is health equity. And I think that COVID, right, the COVID opportunity, the COVID pandemic has created an even bigger opportunity and a more urgent opportunity to focus on it, because now we can really see, as if we all didn't know, that merely standing up a system doesn't, you know, ensure that everyone has equal access or equitable access to care and to removing the barriers to good health. So I think that one of the things that we get to do here across the partners is to, again, like all of the others have said here, you know, set a set of shared goals, but then also make those goals known and put those goals into action, be very intentional about our design and who we bring into the network. And I think one of those, you know, groups that we really need to focus on, because we haven't had a big amount of conversation about it, I think, or as much as we should, is community-based organizations that are led by people of color, right? To make sure that, you know, the folks who really understand this and who've been, you know, in the trenches, really getting out there and maybe just need the resources to scale, the resources from this network and the sort of third rail, I call it, of the healthcare system helping. I think making sure that they're a part of this. It's one of the things that Blue Shield is really trying to do as part of our vaccination effort with the state in our role as the third-party administrator. You know, we're working hard to make sure that we are not just engaging or including, but that we're being very intentional about the design. And I hope that as we all continue to work together here, that's going to be an even bigger part. And I know that it's in the DNA of everyone here, but then to make it a part of the DNA of the network, I think is the level up.
I love that. I love how, like, really it's this greater mission and purpose, and you all share sort of the same ecosystems, right, with community health. And that's one of the grounding factors in how you're able to launch this partnership. That is truly incredible. The question I want to sort of ask you guys is, right, Unite Us is a technology tool to help address social needs. And that's fantastic. But we also have other health IT sort of solutions. And then we think about like larger health information exchange efforts. How does this integrate with all of that? And maybe Dee Dee, we can start with you this time.
The health record systems and the information systems that we're all using, they don't all talk to one another, and that's no secret. And getting there is very expensive. It takes a long time, and having folks surrender suddenly their exclusive hold on different parts of that isn't going to happen very soon or very easily. So I think there's this opportunity for health information exchanges, right? And right now we have a little bit of that going on with this network and others around the state, where we have this patchwork of direct bi-directional exchange of information, but it isn't everywhere, right? And we want to see that everywhere. And I think the stakeholders that we have here could bring that to bear. So I have my 5-year-old who is very interested in this. We think health information exchanges are very critical, right, to not only providing the information, but to assessing a baseline, right, and setting benchmarks and holding us all accountable. And I think we talked about this on our last meetup around, there is a need to democratize the data, the technology, and the other resources so that the very organizations that are serving the communities that are most in need have access to this information without making these massive investments. We talked about our neighborhood health dashboard, which is a down payment, small, but we hope mighty, on providing some geocoded social determinants of health data and making sure that, we at least all have one playbook, even if we have multiple plays, and using this network to coordinate those plays to get to the community level of addressing social determinants of health.
There's a lot of efforts underway in the state of California for getting legislation to pass for HIE, a health information exchange. A state that already has that passed is Nebraska, and Moira, I know Unite Us supports and integrates into that. So maybe you can tell us a little bit more about that.
Sure. Well, I would just say that, the collaboration with HIEs across the U.S., including Nebraska and Washington and other places where we're working, is such a high priority for Unite Us for all of the reasons that Dee Dee just outlined. There's the connectivity, and then there's the transparency of data and the transparency of services so that we can understand where both our healthcare partners are able to connect and where our social care organizations are able to serve, right? And that is absolutely, as you both said, a patchwork. So in California, where there are HIE and CIE networks, already growing or in place, I think that what's happening in California, especially in some of the counties that have already lifted these up, are helping inform conversations across the country. And it's why the conversation in California and the collaboration we're having today is so exciting. So as you mentioned, in Nebraska and Washington, other states, we are integrating with those efforts, really letting our technology and our approach to community building allow those efforts to grow and mature, to include social care organizations as equal partners in this effort, which is so incredibly important. I'll give one example from California. In California, we're super excited by the soon to launch network in Santa Cruz, where our role in the health information organization is both as a technology solution, but also as this network builder. Again, the boots on the ground to bring community-based organizations into this conversation. So, and our process there has been led by the HIE conversations. Those were well established before we came to the community. And community partners tell us every day how they expect us to show up and what technologies they need us to integrate with. And we see ourselves really as a support to that effort. And I want to just mention about this question of the patchwork. It's really interesting that in counties in California with stronger community-based organization networks with more resources have stronger CIE conversations underway. And it's our goal as we build in places that have these conversations, like the Bay Area or Southern California, as well as those parts of our state like Northern California and the Central Valley, where these conversations haven't even begun, that our network building with healthcare partners can really help lift up and fuel an HIE conversation across the state.
Picking up from Moira's last comment, you know, we talk about the importance of community voice and community leadership, but the fact of the matter is, a lot of CBOs are pretty wary because there is, in fact, a power, well, certainly a resource differential, right, between the healthcare industry and the social care world. And I think we need to be transparent about that and really address it. One thing that's really interesting about this approach, and I think it's a large reason that my organization decided to partner with Unite Us, is that it's actually putting healthcare dollars, actual, not little CB grants, not little community benefit grants, but healthcare dollars into the community infrastructure to be used for free by our social service sector, whereby they can, you know, enhance care coordination, track their own clients, generate and use joint data for community-wide planning. So I think we need to be clear that there are things we as a healthcare industry need to be able to answer, like, are we truly just doing this to meet our own business objectives, right? Why are we really in this? And we have to walk our own talk, right? You know, the other thing that comes up a lot is, are we going to medicalize social needs? I think that's another one that we really need to talk about openly. I'm not sure exactly what people mean when they say that, but I definitely, you know, as a long-term advocate before I ever came to work for the civic system, I definitely get it that there's reasons to be fearful about the medical model. I think what we're doing here is really not trying to impose a medical model on the community, but trying to open up the medical model so that it deals with the realities of what really exists in the world and our own patients, because we all know they are far more affected by where they live, what their background is, what their socioeconomic status is, their race, their ethnicity, their language, than anything we do as a healthcare provider. I mean, we're important, but we don't drive the ultimate outcomes very far. So I wanted to be really clear that we need to talk about those things. I am hoping, and I think Kaiser Permanente is hoping, and I think our partners here, that who are so far all women, that this is a step in the direction of opening up that medical model and actually integrate it with the community. So I know I didn't actually answer your question, but we can definitely come back to that if people are interested.
Yes, I think that those are great points that you bring up. But G, what thoughts do you have on this question?
I would say that there are two areas of connectivity that I like to add to what the other has added here. The importance of connectivity to physician practices and to ambulatory and care coordination, community care coordination and navigation teams and the technologies that they use. So this can't be a siloed thing of resource referral, community resource referral systems, care coordination systems on the clinical side, on the community side. All these things, there has to be connectivity to that. The second is the integration with existing community technologies. And when I say that, these are such things as the homeless management information systems, the 211 call centers, and the systems that these organizations use. And the trust needs to be built with these partners, and that the intent is to collectively improve the health and well-being of the community and to collaboratively address the social needs. So it can't be about replicating the assets that are already existing in the community. It has to be about strengthening those assets to enable something bigger and greater. One last point that I want to make on that I want to add here is that we are all becoming more aware of the evolving community needs. We need a way to track longitudinal health and social data. We have to have shared care planning tools. So advocacy and policy partners also need to be a part of this journey alongside the community partners and us doing the work to ensure that what gets built is sustainable and scalable.
The last question for the panel portion before we move on to Q&A and our community leads, we have Melissa back on for this as well. Very exciting. And the question here is, right? Like, what's the call to act? One is, what's the future of this work as you look at the roadmap? What's next? And what's the call to action for folks that are listening in? So, Melissa, since you just joined us, maybe you can start.
I would just start by saying that I really do believe this is a moment in time. We've got some major sort of shocks to the system and changes in California going on that make this a good window for us all to lean in. One is that COVID has obviously made our need for information systems to talk to each other and share data, made the lack of those systems and the impact of that that's critically important. There are federal rules from CMS and ONC now that are driving all of us and all of our systems toward interoperability and more data flow. And we need to take advantage of those as a state. There's this conversation around HIE that Didi mentioned that is hot and heavy in the state, which there's a huge opportunity there to not only to get us all rowing in the same direction around data exchange, but also tap money to do it. And finally, CalAIM, which is the new Medicaid waiver, is very focused on enhanced care management and in lieu of services, which basically means how do you better integrate the sort of social services folks need with their medical care. So all of those things together create a focus of conversation and an opportunity for us to lean in and take chances. And the biggest thing I would say is to reach out to your partners and break silos, like build new relationships, build new ways of exchanging information and caring for people when you know it's the right thing to do. So interested to hear what other people are going to say, though.
My call to action is short and simple, right? This is a start, right? This is a beginning. And we want others, right? We've heard all the why we should be doing this and why we need more partners to do this with. But it's a start. And so mine is simple. Please come one, come all, and especially to bring in, what we're missing and to change that power differential and make sure that we're shaping it in a way that is sustainable.
And Moira, from the perspective of Unite Us.
Thank you so much to learn from. I mean, from the comments in the channel and the Q&A to come and the community leaders to follow. But for us, 2021 is going to be a year of real learning and growth across California. But learning from what we've already built and learning from the conversations we're going to have about how to do this in a way that addresses the trust issues that Sherry mentioned, that addresses the need to have more community leaders come to the fore in our network building to help us inform the way that we're going to build across California. But I think one of the ways where we can do that, and one of the ways that we've started already, is to acknowledge places where networks are already in place in California, maybe not county-wide, but sectorally, like the ACEs Aware conversations are such an opportunity for us to sit at others' tables. And for those tables, those places where healthcare and social care organizations are coming together to address and create a trauma-informed system, how the role that we play is as a support team, to listen to folks, to hear from folks, and to make sure that those efforts can integrate into these larger HIE conversations that we've discussed today. But I would echo Melissa as well that the CalAIM, Aging Master Plan, these are all going to be opportunities for community-based organizations to grow as part of the healthcare system in California, and we want to be there to help make those connections happen. So I would just, and then of course, just echoing Didi, join us, reach out to us. You can find out more about our work across California at our website, california.uniteus.com. You can reach out to me or to anyone on our team. We have a growing team of community engagement folks across California. Most of them come from the social care field themselves, and they're so excited to work with all of you. And so I welcome you to learn and to grow with us.
So I'll bucket what's next on the horizon in three buckets, three areas. The first is sustainable funding models. A lot of great things have been brought up here, the ACEs Aware, the CalAIM. We're also testing the concept of a community bank in some of our communities where the commuter becomes a backbone organization for the work and can advocate for the evolving needs of the community network. In the future, I see development of community hubs bringing together government, payers, providers, community organizations to do more, particularly around the reimbursements, contracting, and data collection. The second piece is specialized community networks. the development of specific use cases that can lead to specialized networks. This can hopefully bring partners to work on the same issues to bring additional funding into the communities, new dollars that weren't available without these types of partnerships. The third is deeper coordination to bring together medical, behavioral, and social care, and which includes transparency around the data to allow for community planning and collective decision-making. In regards to the call to action for those embarking or immersed in this work, first, don't leave out the local partners. If you're at a table designing a solution, strategizing what and how to build community networks, and the local partners are not there, then you have to pause and ask why. And also to the community partners, it's not just about being asked to join. If you're not invited, ask to be invited. This is an inclusive work. And so, and then the second one is, this is a continuous engagement process, and for us to continue to receive community feedback and to co-design this on the solutions. And it's a good reminder that as much as healthcare providers and payers are changing, so are the community organizations. And so to encourage positive change, that there needs to be an opportunity for everyone to change and grow. And that I guess without saying much more, it takes a deep commitment to change and a deeper commitment to grow.
You know, I think this is a process. You know, this is a step forward. We are inviting, I feel like we're opening ourselves up. We're inviting people to join us, and we're asking that joining happen in a really transparent way, where this is not easy work, where there are things that don't seem to fit together. We've got to work it through and figure out how to make it fit together, where there are barriers, because we have underfunded, underrepresented organizations that are really important in our community. That need to be at the table and haven't traditionally been invited. How do we make sure we're doing that? So it's a process where we need many, many, many brains. We need to bring, for-profit, nonprofit, all different kinds of organizations that serve all kinds of needs to tables, and be willing to be honest and work things through. And I think some of the community participants who are actually going to speak in a minute here have been some of those people who we have valued so much, who have come to the table and been honest with us about really how we need to move forward. So thank you very, very much to everyone who put this together. This has just been really, really helpful and moving for me. I think for all of us. Thanks.
Well, I couldn't have asked for a better setup, Sherry, to our community leads. We're going to have Kristen Watson, who is the president and CEO of Kern Community Foundation, Kristen Birtwistle, who's the president and CEO of United Way of San Joaquin, and Gabriel Kendall, who's the executive director of Community Link Capital Region. And so they're joining us for this community leader segment. Of course, we could not have a conversation without our community local leaders who are implementing and partnering with us. So maybe I see, Kristen, we have you on, so we'll get you started with the question and then others as they pop on. But can you tell us about what you think are the opportunities for partnership to expand this work?
Thanks so much for having me. We have been serving as the community convener in Kern for the last 12 months. And I was just telling somebody yesterday what an amazing gift it's been. Not just for us, but for the community. I just came from a spotlight event that we brought partners together to share about what they're doing on the network and more about their organizations, and to see the conversations that are happening within and between organizations. These are conversations that hadn't been happening. So really the network is about how can we grow these trusted relationships, because it's within those trusted relationships that we can really begin to see the impact. When we think down the line, our hope is really that we're thinking differently about not just solutions, but that we're really thinking about our civic infrastructure and how do we bring the right folks to the table to create the space so that we can identify, where we need to put additional resources, or where maybe there's a bit of an overlap, or, just any variety of things. And in time, I think somebody already mentioned, how do we attract additional resources? I think it was G. How do we in Kern County attract additional resources to support this amazing work? So I see nothing but positives happening as a result of the network establishing. We hear day in and day out, thank you for bringing it. It's wonderful. Our community-based organization partners are loving it. I think where we need some support and some help is to bring more of our agencies in, but they're starting to hear, right? And so as they hear, they're like, wait, okay, no, we need a part of this. So it's really exciting stuff.
Awesome. Thank you so much, Kristen. Other Kristen, such a popular name. What do you think? What are the opportunities to further partner and move this work?
I think the potential certainly is limitless. And first of all, thank you for the invitation so much. And I've never met Moira. She's a rock star in my eye. And then G is basically my Yoda. So she keeps us straight and calm through the storm. We started the program, I would say, close to 2 years ago at United Way. And a great partnership, again, with Unitas and 211. Dignity Health, of course. CommonSpirit has been, again, I call it this wonderful, beautiful, perfect storm on so many levels. And, someone earlier said that this is a real medical model. And I'd like to suggest it's really a well model. And we see that the CCN platform, Connected Community Network, has been so invaluable to our community-based agencies. For one, I think the platform has really enriched the relationship, the connectivity we have as an organization with a more personal relationship with each one of our community-based agencies. I'm also a vice chair of the Continuum of Care, the COC, where we're finding that this digital platform has huge impacts in the homeless community, whether it's those people that are in encampments or people that are moving to shelters. And if you think about what life was like before, again, the digital platform, before this coalition of teams, people were waiting a long time for referrals. We're not getting immediate care. And as a consequence, we're ending up in emergency rooms. Now, because again, of this connectivity, this relationship, the continuum of care, for example, is seeing people move from a homeless situation to rapid rehousing. They're moved from somebody have chronic conditions and unstable around mental health or substance abuse to a referral. And we can see it. We can see it. We can track it. Whereas before, once a patient left our ERs or left again a shelter, you did not know where they were going. So I think there's huge opportunities for us to even embolden that even more. Right now in San Joaquin County, we have over 40 organizations that we're working with. Someone also said that healthcare itself is resource rich, while our CBOs are not. And because we are so invested in this program, even though we had some initial bumps, we were able to get 50 laptop computers from the city of Stockton donated, and we're directing those to agencies so they can immediately put, again, the Unitas platform on that computer and be actively engaged and trained and supported. So I think the opportunity is just limitless. I know I've heard from several of our community leaders, gosh, I wish we could integrate more with HMIS. I hear that over and over and over again, but that's an opportunity for us down the road. So we're very happy again with the process, and we want to just continue to see it evolve and grow to affect positive change.
Yeah, amazing. More case for a health information exchange. The last, but definitely not least, Gabriel, I know that you're on the phone.
Thank you for including us. So much has been covered in this conversation up to this point, and I think some of my comments are probably going to be a little bit more on the simple side, but I'm sure we've all heard that piece about the power of vulnerability. And I think that's really what comes to mind so often when I think about the opportunities in these types of systems of care. And I've had actually a couple of opportunities to work with the Unitas platform, both here with my experience with Community Link Capital Region in 2-1 Sacramento, as well as several years back when it was that veteran-focused organization, in my experience working with the Community Information Exchange and implementation of a care coordination network in San Diego, which has a very heavy military presence. the thing that really stands out to me with that piece about the power of vulnerability is it gives an incredible and quite frankly, I would say an unparalleled lens into to what's working and what's not working in your community, and where there's opportunities for partnership to help overcome some of the silos that have been built out in the infrastructure that's in place. You know, we have so many systems of care, and there's state systems and county systems, and you know, there's different funding tracks that create and mandates that have created these silos over many decades. But systems like this allow us to see both from a full client experience as well as a very large scale data driven end where the junctures are in the community that are not working, and seeing where there's opportunities to build collaboration partnerships. So it's, you have a system that helps address this on a large scale, but you're also building a tool that's really effective for the people who are doing the really critical work at the ground level to collaborate upon. So it actually creates an avenue and an opportunity for a really grassroots level creation of partnerships that overcome those deeply ingrained silos in our community. But the only way to do that is being willing to be vulnerable, being willing to jump into the fray with your programs and services, and be willing to see what's working and what's not. But I think through that, the opportunities with systems of care like this really creates incredible efficiencies, and it's really about socializing these service delivery systems so that the onus is not on those vulnerable populations in their times of need. The onus is back on us, the service providers, to help navigate them to care.
Kristen, Gabriel, thank you so much for joining today. Really appreciate it. We knew we could not have this event without the voices of our local and community partners. So really appreciate you guys. We are going to move into Q&A. So first question to this group here: does this wonderful coalition of payers, systems, and funders plan to leverage these tech-enabled community networks to channel more sustainable funds to CBOs and place-based financing models for community health? Example, wellness trusts, outcome funds, etc.
Well, I will just jump in and say this is the kind of exciting work that is just beginning to be part of the conversations, you know, obviously in California, but across the country. And we have, you know, we certainly see at Unite Us, that's part of the opportunities that we have with the networks that we're building to think about really, you know, the long-term goal is diverting dollars from healthcare to 80% of health in the communities. We need to make sure our community-based organizations are strengthened, they're strong, and they're able to do the work that we're asking them to do. We have one just sort of nascent example that I would share here in St. Louis, where they're using the Unite Us platform with local funding with local leaders to funnel CARES Act dollars directly to community-based organizations as those referrals are made. The opportunities to do this really have to be explored across California, and we're eager to do that with partners.
And I think for Blue Shield, I'll just say that we have specific goals about being able to you know, funnel resources where it makes sense, but first to understand what they are and what makes sense and is sustainable, right? I think someone mentioned early on, grants are one thing, but there's more. There's a lot more that we need in terms of being able to build the capacity and the systems to make this work long term for local partners. And so that is definitely one of our stated goals, to be able to do that, right? To create that capacity, to create that interchange of information, and to be able to take those partners long term, right, on this journey with all of us by doing that.
And, you know, I'll just like to add here, especially in San Joaquin and Kern, what we're really testing out is this concept of a community bank. And where the convener, like the United Way or the Kern Community Foundation, they are the fiscal agent of how dollars are all coming in from multiple partners into a community bank, let's say, or a wellness trust. It could be whatever you want to call it. But then those dollars are being spent on what the community needs are, but using that as a primer, right? So it's not you stop there, but as a primer to building other sustainable funding models, because now you have a collaborative, you have a way to work with payers, a way to work with providers, a way to work with government agencies, and because of this community network, you have direct communications and collaborations with community-based organizations. So this kind of work doesn't stop here. It's a primer for establishing different new alternative payment models to be enabled in a community that is inclusive of community partners.
And I would just add one more thought here, which is that exactly what G said, we are experimenting, we are learning. Some of our strategies may not come to fruition, but our goal is to get there. And so wherever we can build on something that already exists, like the counties and communities that have accountable communities for health processes underway, we're trying to see how this fits with that and being flexible to make that work. But we also are saying when things aren't working, that's really why we need engagement, because we need to be able to say, you know what, this strategy may not be the cat's meow, and we're going to try something else. And we need to be open about that.
Shruti, can I quickly just note that there's a great answer in our chat. So one of our participants today, Samantha Klein, says, is pointing out one of the really extraordinary pieces about the data that we've talked about throughout this hour, that the data that we're collecting about the referrals and the clients served and the organizations engaged, that data is really powerful testimony about the meaning of social care work. And as we give that data back, as our organizations use that data to look for other, grant funding to document their work on the ground, that really allows them to articulate their benefit. It's a powerful advocacy tool, I think, for all of us. And so I'm really excited not just to talk hypothetically about it, but to talk practically from the on-the-ground data that we're getting that shows how many organizations, how many families, how many individuals have been served over the last, just in the last month we can document.
Yeah, and I think, part of the call to action was also for more partners, right? So when we talk about sustainability of this work and so on, we need more partners. And so just adding to that is the call to action for everyone on this line right now. Next question, can you please confirm there is a list somewhere that shows Unite Us coverage of populations mentioned earlier, list of locations across the country? Also, when you say working on HIE in California, is that county level, state level, legislation? Can you talk more about that? So I think Moira and Didi, this is, and others.
Sure. Well, I'll jump on the first two and then pitch it to Didi for the statewide work. But certainly on our website, california.uniteus.com, we have a map. But I'm happy to, I was just noticing this morning actually that I need to update it. We had 4 new counties launched last month. The map doesn't show population. I've worked in California for so long, I have a sense of, we sort of think about counties both in terms of population, but also in terms of geographic size. So happy to share that information for folks. And then you asked about our work. Maybe the question was in part about our work with Community Information Exchange and Health Information Exchange. And at this point, our work is primarily county-based. So we're having conversations as we begin to work with a healthcare partner to lift up a new network. First folks who we want to reach out to, the 211s, emergency IE conversations, and Health Information Exchange network conversations at the local level for us right now.
And for Blue Shield of California, we have made no secret of being firm advocates for a statewide HIE. And probably, I would say, I think the biggest thing I can do here is also I want to talk about, some of the coalitions and other folks, right? Advocacy has been huge for us. We have been doing whatever we can to contribute to this because we feel like at a statewide level, if we can have it for all, right? Everybody, instead of waiting for county by county progress, even though that's amazing work, right? And it is the best we have right now. But so we've been real advocates for the statewide effort. And one of the coalitions that we've been working with is Connecting for Better Health. And I just want to call out those 3 objectives, right? Ensure all plans and providers contribute data so that care teams have the data they need in the exam room. Ensure that the state is drawing down on all federal match dollars for health information exchanges to invest to the fullest extent possible, including high-tech 90/10 and Medicaid MITA funds, which other states that we've talked about here are doing a much better job at using, and then building infrastructure that builds off of the current regional systems that Moira was talking about and make sure that the HIE is available to all, right? And so I thought it's really important to call that out, and that, you know, that is a part of the work that we are very much backing, that in work like Link and other efforts toward this statewide HIE.
Yeah, for folks that are interested, the Connected for Better Health, Robbie, who's on the line from Blue Path, they're actually facilitators of that multi-stakeholder coalition. So feel free to reach out if you're interested in learning more about that. Melissa, did you want to say something?
I would add that there are additional resources on the CHCF website on the how other states are organizing their HIE systems, and also what are the distribution of types of HIE systems are already that exist in California. And there's a hearing on Tuesday if anyone is that curious and wants to listen in. So there are many resources available. Again, feel free to reach out for any resource.
Thanks, Melissa. That's a great point. Last question, and I know we only have like a minute to answer this, but Amber asked, this is great and resonates for me because our community is currently having conversations like this and has been for past years. Unfortunately, we have several referral systems in place and we're trying to figure out how they all fit together. Have you come up against this, and what thoughts do you have for her?
Well, I was going to say this may be one that Moira wants to address. I know we don't really have time to dive into it, but California is so well organized. It's such a rich, it's so rich in the discussion of this. I have to say, more than any other state that Kaiser Permanente is in, frankly, we are absolutely coming up against that. And that's exactly the kind of thing that we need to work through. And there are technical components, but a lot of it really is emotional and political. How do we come together and decide what we want to, what do we envision together, and how do we build it? So there are many, many answers to that question. And I wonder, I don't know, and we're just about at time, Moira, if you want to say one quick thing.
I just want to say, I love the idea that you've lifted up that it's emotional and political. It's also practical and it's technological, right? Yeah. And I will say that this is something that we talk about, you know, in every single conversation. What I find so extraordinary is that even when you're talking to a really small community-based organization, they've got two other systems that they want to talk to us about, and we and it's you know, grows every day, right? I mean, so we know that interoperability is something that we focus on, something we focus on as a company, it's something we focus on in practice, it's something we focus on in our conversations. But and from every one of those angles that you mentioned, Sherry. So if the future of California is going to be, you know, expanded resource and referral, closed loop, secure systems where healthcare and social care can talk to each other, these are going to be the kinds of issues that we're going to address. You know, they should have been on the top of all of our 2021 what's ahead, you know, lists. So great question.
All right, guys, we're officially out of time and over. I'm sorry I didn't.
I'm so sorry.
Moderator. Thank you all for participating in this truly, truly amazing work. Thank you to all the attendees for attending. And feel free to reach out to folks on LinkedIn and so on to connect with the panelists. And until the next time, we'll have our next event in May, and that will be on health disparities. So see you then. Bye, everybody. Have a good week.